California is scaling back its pandemic restrictions. It's one of the 14 states hitting President Biden's goal of at least 70% of adults vaccinated with at least one dose. And this morning, we're learning Biden plans to celebrate independence from COVID with a July 4th White House bash. But there are new concerns over the Delta variant for those without vaccinations. The CDC estimates it now makes up about 10% of current U.S. infections. Kaylee Hartung has the latest.
This morning, the Golden State is back in business.
No more physical distancing requirements, no more caps on occupancy.
Starting today, for Californians who are fully vaccinated, life is almost back to normal. When grocery shopping, going to the gym, or a bar, you can ditch the mask. Tonight, Dodger Stadium opening up at 100% capacity.
COVID games are over. We're going to be sold out for the next couple of nights.
Disneyland widening its doors too and welcoming back out-of-state guests and dropping its requirement for masks both in and outdoors for fully vaccinated guests. With more than 70% of adults in California receiving at least one dose, the governor announcing new incentives, handing out 6 in-state dream vacations to try to get shots into those remaining arms. And as the U.S. nears 600,000 deaths from COVID, and with more than 300 people still dying every day, the need to protect the population is as urgent as ever.
370 deaths, that's significantly lower than at the peak of this crisis, but it's still a real tragedy.
Crystal Morgan lost her 15-year-old daughter, Dakota, just last month.
Dakota had no underlying symptoms or illnesses or diseases, and the virus took her in less than 72 hours from the first time she presented a symptom.
And now new concerns over the Delta variant for those unvaccinated. The CDC estimating about 10% of current infections in the U.S. are due to that variant. And in the U.K. right now, it's responsible for 90% of cases. But according to 2 new studies, preliminary data shows that the Pfizer and Oxford AstraZeneca vaccines can fight the variant and are more than 90% effective at keeping those fully vaccinated out of the hospital.
So, Diane, here at Dodger Stadium, without capacity limits and no social distancing requirements, they are looking to sell this place out tonight, pack it with 50,000 fans. But even for those who are fully vaccinated, there are still some places where you do have to wear masks. In hospitals, on public transportation, in long-term care facilities, and indoors at K-12 schools and child care facilities. But let me leave you with a warning, Diane, for those 50,000 people who are expected to be here tonight. Come early. Diane.
All right, good tip, Kaylee Hartung. Thank you. And let's go to physician at Stanford Children's Health, Dr. Lok Patel, for more on all this. Dr. Patel, thanks for being here. What do you make of this 14-state number? 14 states meeting this goal of 70% of adults at least partially vaccinated. President Biden was aiming for the whole country to hit that by July 4th. So how are we doing?
Well, as you mentioned, we're not even halfway there. And if you look at the actual vaccination rates in this country by day, I mean, we were above 3 million in April. Right now, we're under 1 million. Part of that is because, yes, we vaccinated the most vulnerable and the people who are eager to get it, such as health professionals, early. But honestly, now, Diane, there is a bit of a slowdown. And if you actually look at the state-by-state data, there is a clear difference between those blue states and red states. And, you know, I hate to see this level of vaccine partisanship, if you will, but I think it just sows the need for there to be that community level conversation. And we need to look to see how we can work together as a country. And hopefully with this new kind of vaccine tour by the Biden-Harris administration and more on the ground communication, we'll get there. But it doesn't look like we're going to meet that goal by the 4th of July.
Now, the CDC estimates the Delta variant is now causing 10% of current infections in the U.S. It's responsible for 90% of UK cases. So how concerned should we be about that, particularly as we hear in the UK, it seems to be affecting the younger population more than previous variants?
And as we all know, because you and I were both young yesterday, the younger population are the ones who are more likely to kind of get out there when things start to reopen, go to those events, those concerts, bars, Disneyland, whatever. And if you have a variant that's easier to transmit from one person to another, that is a cause for concern. You know, I saw an analogy. If you imagine that SARS-CoV-2 infecting our cells as like a key going into a keyhole, the Delta variant is a more efficient key, and it might even be better at turning the deadbolts. And so I do worry about those people out there who have not yet been vaccinated, especially those who may have underlying conditions, as even kids who may have asthma, type 1 diabetes, or obesity. They're at a particularly high risk. And we have these kind of pockets of vulnerability in the country, especially in places like Mississippi, where that vaccination rate is not high enough to fight off a potential Delta variant outbreak.
So the more of us who get vaccinated that can, we then help to protect the younger people who aren't of age or those who have other conditions that would prevent them from getting vaccinated. So how close are we to herd immunity? Does that still seem like an achievable goal?
I hear the reluctance in your questions, and
I'm almost
that's
afraid
exactly
to
how a
ask
lot
it.
of us feel. Well, I think herd immunity itself is kind of a moving target. And this is not just my opinion. This is the opinion from public health experts, infectious disease experts, worldwide. It's a moving target because it could change depending on what city you're in. It could change depending on the variant. But I think the first thing you brought up in this question is really important. Back in December, January, people were saying, hey, I'm getting vaccinated for myself, to protect myself. But we have enough information to tell us that vaccination can also prevent transmission of the virus. You're protecting everyone around you. And I think as we start to reopen, we'll see a combination of that natural immunity and the vaccine-acquired immunity to kind of keep bringing cases down. But again, scientists aren't sure how long that natural immunity from getting COVID in the past actually lasts. The safest thing for people to do is actually go out there and get the shot if you haven't already.
All right, Dr. Alok Patel, it's always great to have you. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.